Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about what instructions post-operatively you need to follow after your LANAP or laser assisted root planing curettage procedure. Let's start. So if you're watching this episode, you've undergone some sort of a laser procedure such as LANAP or laser assisted root planing or curettage therapy. Be advised that whatever I'm saying in this are the instructions for you to follow post-operatively. Please be apprised that we have to meet you after 21 days minimum. Usually a lot of people do it 14 or 15 days, but I preferably prefer that it has to be 21 days post-op that we can have a follow-up. Now, if you've undergone the procedure and now you're away from the dental chair and you're in the recovery room or you're back home, you have to be very careful about what all instructions you need to follow. You can go ahead with your regular brushing and that's not a problem, but you have to follow some other specific sets of instructions for your well-being in recovery. The first thing is that you have to start with a warm saline rinse mouthwash regimen, which has to be in twice a day. Basically, you put in a glass of water, warm water or lukewarm water, you need to put a pinch of salt and need to gargle and rinse it around your mouth. You don't need to use a mouthwash just as yet. In my personal experience, for the first 3 days, you don't give them a mouthwash, you give them a warm saline rinse therapy, which is a very good antiseptic, and fourth day onwards for 15 days, you can start off with the mouth rinse. Now, after that, you're supposed to gently brush the area. If you're having a lot of soreness in that area, you can avoid brushing there for the next 3 days. Also be apprised that if you get some bleeding in the mouth, for example, that must be the main complaint that you would have come to us for, that is the bleeding gums. Don't be alarmed, we have not caused anything iatrogenic or any sort of injury. It is just that the gums have a raw eroded surface from the inside and they are a little delicate and friable. So if you're brushing and you see a little spot of blood in your sputum, it's not a problem, it's going to be fine after 3-4 days. Now, if you've done root planing and curettage along with laser therapy, there's a high likely chance that you might get sensitivity, which is transient. So for the next 3 days, you can use a desensitizing toothpaste and don't be alarmed about the sensitivity, it will go away. In case it doesn't go away, don't worry about it. We have other desensitizing therapies to offer in the in-office segment. And also you have to be very careful about the fact that if you notice any swelling, any painful swelling that has come out to be and it is putrid or has an exudate, please feel free to call the dental office where you were operated and don't hesitate to call them. In case the bleeding has not stopped, you don't need to worry about it. You can use a tea bag and place it right next to the gum where the bleeding has happened. And also, if you feel that the swelling has increased, you can use an ice pack 15 minutes on and off. The diet has to be soft. It doesn't have to be fibrous. It doesn't have to be very hot. It doesn't have to be very salty. It doesn't have to be very crunchy. So avoid nuts and all those things for the next 3 days and then you can continue with the diet. And the follow-up period is generally, in our clinic, it is 21 days. Otherwise, your symptoms should subside within the next 3 days, be it sensitivity, pain, bleeding gums or whatever. If they don't, please do not get scared or panic. Just call up the dental office and they can align an appointment with you ASAP for taking care of your oral health. The last thing, the most important thing, is that the antibiotics and the anti-inflammatory medications that we've given. Now, anti-inflammatory medications are commonly called as painkillers. A lot of you might not have pain post-operatively and you might not take the painkiller, but that's not the case because a painkiller is also an anti-inflammatory medication. Once we have treated you with the gum surgery or the LANAP or anything of that sort, if we have given you pain medications, it is absolutely a requirement for you to take that, because we want to reduce the post-operative inflammation. And if for any medical reasons or any sort of iatrogenic reasons that the surgery was long or exhaustive, if we have given you antibiotics, please make sure that you have taken the antibiotics as the course and the regimen that has been defined by your clinician. And don't worry, this process and procedure is very minimally invasive and you get very good results. The follow-up at our clinic is usually 21 days. Other clinicians might do it at 15 days as well. But we, for our own purposes and whatever studies we've gone through, it is better to do a follow-up at 21 days. And you should start feeling better soon. So this was today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location and the common oral health problem that's giving you discomfort, and then we can have a talk. And if at all you have any queries, doubts, apprehensions or insights, please feel free to put them into YouTube comment section. So that's it for today. Thank you.